Grab your foam roller. Come to sit on it for a glute med release. Crossing one ankle over top of the knee, dorsiflexing the foot. Whatever leg is over top, you're going to lean into that glute, placing your hands behind you for leverage. You'll inhale, pull your abs in towards your spine, brace those muscles that stop your stream of pee, and exhale the air out the mouth as you dig into that fascia, opening up that outer hip. Breathe in, pull the belly button in, keep the sternum reaching towards the back ribs, and exhale the air out. Again, inhale. Pull in on the muscles that stop your stream of pee, in and up. Hold that lift, sternum reaching towards the back ribs. Exhaling it out, sustaining that lift with the pelvic floor. Go ahead and switch sides. Setting up on the other side, make sure that the foot that's crossed over is dorsiflexed. This helps with the knee traction. Use your elbows or your hands behind the glutes. The fingers can be facing the buttocks or out to the side, but they shouldn't be facing back because that's not great for the fascia around the elbow. So make sure you're breathing here. Inhale, pull the belly button in, lift up on those muscles that stop your stream of pee, and fog a mirror with your exhale. Inhale, we're contracting the transverse abdominis every time we pull the abs in and tug up on those muscles that stop the stream of pee, and we sustain it. We contract the deepest layer of our core. This will help alleviate chronic back pain and deeply condition the innermost muscles of the abdominals. One more breath here. Inhale, pull the abdomen in towards the spine, hold it in, lift up on those muscles that stop the stream of pee, and fog a mirror with your exhale. We'll come off the roller, setting it to the side, grabbing our anti-burst ball, coming to lie supine, placing that ball underneath the sacrum, bringing our pointer fingers to the bony protrusions of your hips and guiding them down, creating lumbar extension, and then tipping them back to neutral pelvis. Let's connect this movement of the pelvis with the breath, exhaling to tip the pelvis down into low back extension, arching the low back, bracing the abdominals, and then inhaling, breathing laterally into the rib cage to tilt the pelvis back to neutral. Exhale, brace the abs, tipping into extension. Inhale, bringing the pelvis back to neutral. Keep going with that. Make sure your rib cage isn't pressing out, that you're thinking about the sternum reaching towards the spine, the back ribs pressing into the floor. You're thinking about the bones of your big toes heavy on the floor so you're not rolling out on your feet. We want to combat the tendency to supinate that we see with sway back posture. A couple more pelvic tilts here using your breath. After your last one, I'd like you to set your arms down by the hips, pressing them into the floor, activating your arm extensors, triceps, wrists, hands heavy. We're going to float one leg up into butterfly. We'll be doing butterfly press outs on a 3 count, staying on one side with the other leg down, pressing heavy through the bone of the big toe with the leg that's down. Brace the abs as you press out. 2, 3. Inhale, bring it in. 2, 3. Brace the abs. Exhale, press out. 2, 3. Inhale in. 2, 3. Make sure the rotation of this leg, and you can continue going, is from the top of the hip socket and not from the knee or ankle. We don't want to aggravate the knee. And as you press out, you'll feel the hip flexor and the lower abdominals working. Bring it in. 2, 3. 2 more on this side. Exhale out. 2, 3. Inhale in. 2, 3. Last one on this side. Exhale out. 2, 3. Inhale in. 2, 3. Lowering that leg down. Setting up on the other side. Brace your abs to lift the other leg. External rotations from the top of the hip socket. Bone of the big toe of the foot that's down is heavy. Sternum is reaching towards the back ribs. Tailbone is reaching away from you, so you keep lumbar extension, but always remember the bracing of the abs as you press that leg out Inhale to pull back in. Keep moving on the breath with the tailbone reaching away from you towards the bottom of the mat, towards the legs, and the sternum reaching towards the spine and the back ribs heavy in the mat. Pressing into the mat, chin retracted, double chin to lengthen the back of the neck and turn on the neck flexors, the weak muscles in front of the neck. Exhale as that butterfly position presses forward. Inhale as you bring it back in. From here, we'll bring that leg down after you finish your last one. Lifting the pelvis up, sliding that ball out. We'll anchor our lightest Theraband, tying it to our foam roller. Coming onto our knees on the foam roller with the ball between the knees. Setting up for lateral flexion. We're loading our bottom arm. We'll do a 2-breath isometric hold. Side bending, keeping the ribs close, sternum reaching towards the back ribs, adding the bottom arm, palms facing in, framing the face, chin retracted or turned down to keep the back of the neck out of it. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale, brace the abs and bring yourself back upright. Continuing side bending, adding the bottom arm. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale, abdomen in, contract those abdominals. Exhale, coming back up to center. One more set. Side bending on your inhale, adding the bottom arm on your exhale. Reach the sternum towards the back body, pull the navel in towards the spine, tug up on those muscles that stop your stream of pee. Fog a mirror with your exhale. Inhale, brace the abs. Exhale. And inhale, brace the abs, coming back upright. Go ahead and come off the roller. Switching sides, setting up for lateral flexion on the other side. Side bending, inhale. Add the bottom arm, exhale. Hold, inhale 1, plug the shoulders down the back, exhale 1, retract the chin, inhale 2, exhale 2, inhale, sternum reaching towards the back ribs, exhale, brace the abs, come back upright. And side bend on your next inhale, add the bottom arm, exhale, inhale, brace the abs, and exhale. Inhale, pull the navel in, lift up on the muscles that stop your stream of pee and fog a mirror as you come back upright. And last time on this side, side bending over, adding the bottom arm, bracing the abs. Inhale, brace, retract the chin, exhale. Inhale, shoulders down the back, brace, exhale. Expanding the side body, inhale. Pulling the navel in, lifting up on the muscles that stop your stream of pee, fog a mirror as you exhale. And lift all the way back up to center. Coming off the roller, setting it to the side, grabbing our heaviest Theraband. Ball will be between the knees, feet will be dorsiflexed, band around the arch of the feet. We'll hinge back with a tall, flat back from tailbone out through the crown of the head, sternum reaching towards the back ribs so you're not pushing your rib cage forward. And we'll do some bow and arrow twisting at the bottom. Inhale, exhale, twist, 2, 3, 4, pause, inhale, brace the abs, back up to a tall spine. Dorsiflex feet, heels digging into the floor, squeeze into that ball, tailbone, all the way out through the crown of the head, long energy line. Keep going. As you twist on your exhale, pause to inhale, brace the abs to bring yourself back upright. Use your breath here. Remember, the movement is on the exhale. We have a pause on the inhale, breathing laterally with awareness of what's happening in your pelvis. Your tailbone is driving down, creating lumbar extension with the support of the abs being pulled in and the pelvic floor muscles being lifted up. You're doing great. Continue with that inhale. Pull the abs in. Lift up on the muscles that stop your stream of pee as you hinge back with a tall spine. No rounding in the lumbar. Tailbone reaching down and away from you. Belly button reaching in towards the spine. Sternum reaching in towards the spine. Shoulders plugged down the back. Chin retracted. These rows, one arm reaches forward as the other reaches back. Head turns with the arm that's reaching back, brushing by the side body. Palms should be facing in towards one another for your bow and arrow rowing and twisting. Finish up your last set, coming up to a tall spine, setting that band to the side. Great work. We'll set up to lie supine. We've already got our lightest band anchored to our foam roller. We'll need to pin it with our feet, lying on our back, supine against a wall, for unilateral overhead pulls with lateral flexion. We'll start with one arm pulling up, palm facing in towards the chest, all the way overhead. Other arm does the same motion, and we side bend towards the side that isn't loaded with the band. Back to center, arms come back down, repeating. Pulling overhead, engaging the lat, which attaches under the armpit, and side bending to engage those external obliques and open up the intercostals on the opposing side. And back to center and down. Pulling overhead. Go at a tempo that allows you to breathe and to breathe consciously, thinking about the engagement of your TVA. So your tailbone is reaching down towards those feet that are dorsiflexed. You've got lumbar extension, so you've got a mouse hole between your floor and the low back. Finish up the last one. And then we'll come to sit up, bracing our abs, switch that roller, pinning it with our feet again, and working on the other side. Unilateral overhead pull into lateral flexion, side bending. Think about your back ribs. How heavy can you imprint them into the floor for this entire exercise? Really work to imprint the mid-back and upper back into the floor. That tailbone, however, is reaching down and away from you. We want the lumbar extension, better pelvic position, since sway back posture is in chronic pelvic flexion. We want to open that low back for more space. Continuing on the breath, bracing the abs to lift overhead, pausing once the arms overhead. Inhale, brace the abs to move into that lateral flexion with the back ribs imprinting. Inhale here, opening up the intercostals. Brace, exhale back to center to lower that arm. From here, we're going to come onto our knees for a 3 count, opposite leg extended. Hand is going to come to, the knuckles will come to the forehead opposite hand. And we'll do some torso twisting. Again, opening the intercostals and twisting for the transverse abdominis, contracting that deepest layer of the core. So the leg is in an isometric hold, lifted behind you. And you're going to twist back to center. Exhale, twist. Inhale, center. Taking 3 counts to twist up. 2, 3. Inhale, lower. 2, 3. Exhale, twist. 2, 3. Inhale, lower. 2, 3. Rotations from the rib cage, the pelvis, those bony protrusions of the hips, stay square to the floor like headlights. The leg is held isometrically, no movement. The only movement is that rotation of the torso. So really brace your abs, reach the sternum in towards the back body, rotating from the rib cage. Retract your chin, double chin, so that the back of the neck is long. Finish up your last one and go ahead and set up on the other side. Make sure the toes of the knee that's down are tucked on the floor and you're not balancing on the knee. We want some stability and we want to distribute the weight between all 5 metatarsals that are down. Go ahead and begin the work on the other side. We always have one side that's easier than the other. If this is your challenging side, just remember to connect that twist with the breath, the lift of the lower abdominals. Sustain that lift and contraction for the duration of your exhale. The longer you contract your transverse abdominis, the deeper you condition it, and the more you will alleviate that low back pain. Inhale, pull the abs in towards the spine, lift up on the muscles that stop your stream of pee as you exhale, twist. Inhale, breathing into the rib cage as you come back down. Pull the abdomen in, lift up on the muscles that stop your stream of pee, brace those abs, sustain it. Exhale, twist it. Retract that chin, inhale back to center. From here, we're going to come to lie prone on our abdomen, now pinning the roller to the wall with that lightest band. The feet pin it as you lie on your stomach, and we'll do a T-pull all the way overhead. The other arm will we'll do the same thing as the arm that's loaded. Make sure the bony protrusions of the hips are anchored to the floor. Your belly button's pulled in towards your spine. As you lift overhead, you brace the abs and exhale. And inhale back down. Brace the abs and exhale. And inhale back down. Again, brace your abs and exhale. Inhale to lower. Bracing the abs, exhale. Inhale, lower. Good work. Brace those abs, exhale. Inhale, lower. And from here, we're going to switch sides, setting up on the other side. Make sure the bony protrusions of the hips are anchored to the floor. You're staying aware of the chin being retracted and the shoulders plugged down the back. Rib cage moving in towards the spine. Inhale, prepare. Exhale, brace those abs to bring the arms overhead with the shoulders plugged down the back. It's very easy here to have your rib cage pushing forward, ribs pressing into the floor. Make sure you reach the sternum in towards the back body, plugging the shoulders down the back. As you take the arms up, you brace the abs. As they come back down towards your hips, you inhale. Move on your breath, taking your time. Sternum reaching towards the back body, belly button pulling in towards the spine. Inhale, brace the abs. Exhale. And inhale, brace those abs. And exhale. From here, we'll come to a kneeling psoas stretch. And we'll use this lightest band that's attached for overhead tricep extension with lateral flexion. So we'll take the band, and it'll be in the same arm as the back leg. As you side bend towards your front leg, keeping the pelvis tucked under slightly to open up the hip flexors. Breathe here. Inhale. And on your exhale, you'll give me 3 tricep extensions. You'll pause to inhale, breathing into the side body. Sternum reaching towards the back ribs, abs pulling in and up. And exhale to extend that forearm up and down 3 times. Make sure the bone of your big toe of the foot that's down is really heavy so that the knee isn't rolling out and you aren't rolling out on the foot that's down. Your back toes should be down so the weight isn't all on that knee. Let's go ahead and set up on the other side for our kneeling psoas stretch with overhead tricep extension and lateral flexion. Moving on the breath. Inhale long, exhale to side bend. Give me 3 tricep extensions here. 1, 2, 3, and bring yourself back upright. Inhale, bending the elbow to side bend, staying in the lateral flexion. Exhale, extend. 3, 2, 1, back to center. Inhale, last time, side bending, brace those abs. and extend. 3, 2, and 1, and back up to center. Good job. We'll set up for some supine bridging with inversion of the legs. The inversion happens from the top of the hip sockets. The legs are hip distance apart. The knees will come together. We're going to keep them together. The bones of the big toes are heavy. Pressing into our arm extensors, our triceps, hands, wrists, we pick that pelvis up into the air, holding at the top for 1 breath. Inhale, 1, breathe. Exhale, 1. Inhale. From the sternum, we puddle the heart down, imprinting each vertebra into the mat. Tailbone reaches away from the body towards the toes. At the end, pause, inhale, pull the abdominal wall in, lift in and up on the muscles that stop your stream of pee as you press up. Press through the bones of your big toes, keeping that neutral pelvis lifted. Inhale, 1, breathe. Exhale, 1. Inhale, peeling down from the upper back, mid-back to tailbone. Pausing at the bottom, inhale, breathing laterally. Pressing heavy into the bones of your big toes. Pick the pelvis up, hold it up. Inhale, 1, breathe. Exhale, 1. Inhale, sternum reaching towards the back ribs, body imprinting into the floor as it comes down, tailbone reaching towards the toes at the bottom. Inhale, bones of the big toes heavy, sternum reaches towards the back ribs. Pick those hips up, neutral pelvis at the top. Inhale, 1, breathe. Exhale, 1. Inhale, peeling down vertebra by vertebra. Imagine ice cream on the chest, puddle the heart inward. Tailbone's last, tailbone reaches towards the feet. Bones of the big toes heavy, knees should be staying together, triceps should be engaged, wrists, palms pressing heavy into the floor. Pick that neutral pelvis up, hold it up. Inhale, 1, breathe. Exhale, 1. Inhale, brace those abs, peeling down upper back, mid back to tailbone, reaching the tailbone towards the feet. We'll set up, grabbing our heaviest Theraband to put around our feet for a side lying double leg lift. You'll put both feet into the band and the arm will rest by the side of the body, that top arm. You can either place the ball under your head for side lying or you can rest your head on your bicep. We're going to breathe in, brace the abs, lift both legs up. Inhale at the top, brace the abs, and lower both legs down. Breathe in, brace, exhale, lift. Inhale at the top, brace, and exhale, lower. One more at that tempo. Inhale at the bottom, pull the abs in towards the spine, sternum reaches towards the back ribs, lift up. And inhale, lower immediately down. So now we brace, lift, exhale. Inhale, lower. Brace, lift, exhale. Inhale, lower, lengthening the body. Using the abdominals to initiate the lift and lower. Keeping the ribs closed. The tailbone reaching behind you for some lumbar extension. On your next one, I want you to hold it up. And with your legs parallel, I'd like you to invert the legs from the top of the hip socket. So you're moving the legs from the hip sockets, inversion, and then back to parallel. Inversion to parallel. The breath is exhale to invert, inhale, parallel. Exhale, invert, inhale, parallel. Exhale, invert. Inhale, parallel. You're doing great. Keep going. Exhale. And inhale. Stay long. Sternum reaching towards the back ribs. Abs pulling in and up. Tailbone reaching behind you. Chin retracted so the back of the neck is long. Brace the abs. Inversion. Inhale. Parallel. Brace the abs. Inversion. And parallel. One more. and lower the legs. Let's set up on the other side. We'll begin with our double leg lower and lifts. Take your time setting up. Ball under the head or head resting on your bicep. Feet are active. Flexing those feet will help keep the band captured. The top arm is resting along the side of the body. We have the assistance of this heavy Theraband around the feet. As we lift up, we brace the abs. Inhale at the top, brace the abs, and exhale, lower down slowly, keeping this nice tempo to begin. Inhale, belly button to spine. Lift up on the muscles that stop your stream of pee. Sustaining that lift, hold at the top. Inhale, breathing into the rib cage. Pull the abdomen in. Lift in and up on those muscles. Hold them tight. As you exhale and lower down. Inhale, pull the abs in. Brace as if you're going to be punched in the gut. Lift all the way up. Inhale, lower. Moving at a quicker tempo. Brace to lift. Inhale, lower. Brace, lift. Inhale, lower. Keep that going. Some checkpoints. The feet nice and flexed. The legs parallel. The tailbone reaching behind you for lumbar extension. The belly button pulling in towards the spine. The sternum reaching in towards the spine. Collarbone wide, shoulders plugged down the back. Next one, hold it up. Moving into inversion from the top of the hip sockets. Back to parallel. Brace the abs. Exhale, inversion. Inhale, parallel. Brace for inversion. And inhale, parallel. Keep that going. Check in with your checkpoints. Feet dorsiflexed. Try to not lock the knees into hyperextension. Keep a subtle bend in the knees. Keep your shoulders plugged down your back. Retract your chin. Make sure that you're not gripping in your neck. Collarbone wide. Sternum reaching towards the back ribs. Find that breath. It's either a lift, a sustained lift of the pelvic floor muscles, the muscles that stop your stream of pee, or you're imagining someone punching you in the gut and you're bracing and it's a sound. Either way, you'll contract the TVA to condition the deepest layer of your core. Finish up your last one and we'll release that. We're going to elevate our pelvis, still holding on to that heavy Theraband with one hand, elevating the pelvis with the anti-burst ball for some inversion footwork while we stretch our IT band. So crossing the leg, one leg across the body, the other foot can be down for stability, one hand down for stability. Arch of the foot around the band and we'll take the foot in towards the face and back to parallel. In towards the face and back to parallel. Reach the tailbone away from you as you're working here to accentuate that lumbar extension, your sternum reaching towards the back ribs and moving into that nice inverted position of the foot, back to parallel and inversion, parallel, bracing the abs as you invert and parallel. This is really good to combat the supination we see with sway back posture due to the bow-leggedness and overactivity of the lateral hamstrings, the glute med, the calves, especially the peroneals and the IT band. Couple more breaths here, trying to squeeze the quadricep to lift the kneecap, maximizing the stretch in the IT band, dorsiflexing the foot evenly. Go ahead and switch sides, setting up on the other side, having one arm down so you don't roll off the anti-burst ball, making sure that ball's high enough that you can arch your low back, reaching the tailbone away from you towards that foot that's down. The foot that's down, the bone of the big toe's heavy. You've wrapped that heavy Theraband around the arch of the foot, inverted the leg from the top of the hip socket and moved it across the body to get into the IT band and lateral hamstring. As we work the foot, bringing it into inversion, back to parallel. Brace the abs, inversion and parallel. Keep going at that tempo. Be cognizant of your breath. Sternum reaching towards the back ribs. Chin retracted. Collarbone wide. Inhale. Brace those abs. and exhale. Think about the quadricep, the front of the thigh, lifting that kneecap up, maximizing the stretch in the calf and the hamstring. Isolating the footwork from the ankle joint, not from the knee or the hip flexor. Finish up your last one. And set the band to the side, placing that foot down. Pick the pelvis up and slide the ball out. Lower the pelvis down. Great job. Before we begin our cardio burst, we're going to open our side body and hip flexors. I'd like you to lift one arm up into the air and grab it with the opposite hand. We're going to cross the leg behind the other, pressing the hips forward and bending laterally. Opening up the intercostals here as well as the hip flexors. The hip flexors are not a posturally tight muscle, but they do get tight due to sitting, which we all do quite frequently with work and travel. The intercostals, the lats, are active and are tight posturally. So we really want to open and breathe laterally here. Inhaling, brace those abs. Exhale. One more breath here. Inhale. Abs in, tailbone reaching back, sternum reaching back. Exhale, side bend deeper. Go ahead and set up on the other side. Remembering to drive the hips forward to maximize the stretch in the hip flexors and to really bend laterally. If you're straining in the neck, you can tuck your chin to chest, lengthen the back of the neck, plug the shoulders down the back. Collarbone is wide. Inhale, brace those abs, and exhale. Each exhale is a chance to bend deeper into the stretch, as long as you're keeping your sternum reaching in towards your back ribs, your tailbone pointing down and back so you have some lumbar extension. You're never pressing the belly out, always pulling it in towards the spine, lifting up on those muscles that stop your stream of pee. Collarbone wide, shoulders pressing down the back. From here, you can release that stretch. The equipment you're going to need is your lightest loop band, your anti-burst ball, and your 3-pound weight. We'll learn all 3 exercises before we begin our cardio burst. Perform these exercises at 50% effort, just so that you can learn them and get confident. Our first exercise will be in the frontal plane, traveling side to side. We'll use our lightest loop band around our ankles, hands on our hips for marching to the side 4 times, standing in place with a soft bend in the knees. We're going to cross punch in the direction we just traveled for 4, 3, 2, 1. Hands back to the hips, marching to the other side, punching in the other direction for 4, 3, 2, 1. So make sure and dorsiflex your feet as you march. That will ensure the safety of the knees as you march here. We're recruiting our hip flexors as we work. Make sure also you don't round your low back, that your tailbone is reaching back behind you. This will ensure you engage the abs and you keep the low back safe. Our next exercise, we'll hold our 3-pound weight on our chest, and you can either do leg reaches, 8 of them, to do a quarter turn, 8, 7, 6, 5, 4, 3, 2, 1, or little scissor jumps. They look like this, 8, 7, 6, 5, 4, 3, 2, 1. Whatever you choose. After that, you'll do 2 reverse lunges, alternating 1 and 2, and then we'll repeat after our scissor jumps or our leg reaches back to the other side, 8, 7, 6, 5, 4, 3, 2, 1, and then 2 reverse lunges. We're just holding that weight at our chest, reminding ourselves to keep the upper back lifted, those upper back extensors active, bracing the abdominals as we step back for that reverse lunge, engaging our glute max and our glute min. These little scissor jumps allow us to recruit our hip flexors. So this is our transverse plane burst. Our final burst will be in the sagittal plane, traveling forward and back. We are going to need our anti-burst ball. We're going to hold it on our chest as we do 8 butt kicks or leg reaches. So leg reaches look like this: 8, 7, 6, 5, 4, 3, 2, 1. And then we'll place the ball between the knees and we'll swing our arms to shoulder flexion as we sit back for a squat. 1 and 2. Grabbing the ball, placing it back on the chest for our leg reaches back. 8, 7, 6, 5, 4, 3, 2, 1. Ball between the knees for 2 squats. 1 and 2. Option to run these butt kick runs with the ball on the chest forward and back. If you don't have any chronic back pain or knee pain, this is a great option to elevate the heart rate. If you do, I would keep it to the leg reaches until you work on your feet and ankles, balancing them, and aren't experiencing any knee discomfort or back pain. So let's set up for our first burst in the frontal plane with our lightest loop band around our ankles for our marching to the side and our 4 cross punches. And here we go. 4, 3, 2, 1. Cross punch. 4, 3, 2, 1. Keep that going. 100% effort now. Dorsiflex your feet. Reach the tailbone behind you. Brace the abdominals. Give it all you got. 100% effort here. Dorsiflex the feet. Lightest loop bands around those ankles, allowing us to access our hip flexors. Those cross punches allow us to access the TVA. Keep the sternum reaching towards the back ribs. There shouldn't be pelvic movement as you twist and punch. Shoulders plug down the back. Collarbone wide. You're doing great. 100% effort here. Counting you down. 5, 4, 3, 2, 1. Take your recovery. During your recovery, grab a sip of water if you need it. Stretch any muscle that feels like it needs attention. We're going to be repeating this exercise in the frontal plane at 100% effort. We're conditioning the heart. Cardio bursting helps with stress and anxiety management. It also boosts endurance, which is great for your heart health long term. I'm going to count you in. 8, 7, 6, 5, 4, 3, 2, 1, go. 100% effort. Side marching, dorsiflexed feet. That band should be around your ankles, which makes it easier for the marching. And your hands are on your hips. And then we do those cross punches. About chest height, there's torso twisting, but we're not moving our pelvis as we do those cross punches. We've got pelvic stability, so we can really recruit the transverse abdominis with our twisting. Halfway there, 100% effort. Nice marches. Remember to think about that tailbone reaching back so we have lumbar extension. This will help keep your back safe as you pull in and up, and brace your abdominals every time you pick the leg up and you dorsiflex those feet. Those cross punches, give it all you got. Counting you down. 5, 4, 3, 2, 1. Take your recovery. We have a minute here, recovery. Do not sit down. Grab water if you need it. We want to keep the heart moving back to its normal rate and then spike it up into a deep, deep cardio burst. Cardio bursting is recommended 3 times a week. That's the minimum for heart health. And that's between 4 to 8 bursts with a 3 to 5 minute warm up and a 3 to 5 minute cool down. The recoveries between each burst can be anywhere between 30, 45 to a minute. So our next exercise, we have our 3-pound weight. We have our scissor jumps or our leg reaches, 8 of them to turn in the transverse plane, and 2 reverse lunges. Make sure you're really pressing into the bones of your big toes for those reverse lunges so that your knee tracks. Here we go. And 8, 7, 6, 5, 4, 3, 2, 1. Bones of the big toes heavy as you step back into your reverse lunges to engage those glutes. The weight you're holding with both hands and it's resting on the chest. Those scissor jumps are small little jumps, or you've got your leg reaches back. Whichever you're choosing, make sure your tailbone's back. You have lumbar extension. You're pulling your abs in and up, recruiting the lower abdominals. Breathe in, bracing the abs. Keep that going. 100% effort. Scissor jumps or leg reaches. Bones of the big toes nice and heavy on those reverse lunges. Think about the bones of the big toes really active throughout this whole exercise so that once you get to the lunges, you don't have to think about it as much. Even on the leg reaches, if you're walking those or if you're jumping your scissor jumps as well, really active in the bones of the big toes. Counting you down. 3, 2, 1, recover. You've got a minute here. Grab water. Staying hydrated is really important. You should be having between 8 to 10 glasses of water, and that's 8 ounces a day. And for every cup of caffeine and alcohol you have, you need to replace that with an additional cup of water. Being hydrated is one of the huge factors in weight loss. So if you're not drinking water, commit to a 21-day challenge of hydration, 8 to 10 glasses a day, and an additional cup for every cup of caffeine and alcohol. So I have a cup of coffee and a glass of wine at night. So that means 10 cups of water for me to be hydrated every day. Okay, counting you in, second set in the transverse plane. 5, 4, 3, 2, 1. Give it all you got. Scissor jumps or leg reaches. Tailbone back, sternum reaching towards the back ribs, collarbone wide, shoulders plugged down the back. Those reverse lunges, bones of the big toes are heavy. Knees should be tracking over the second and third metatarsals. Challenge yourself to go a little harder than you think you can. 100% effort. Remember, we're only doing 6 full minutes of cardio bursting. So you really want to maximize your time by giving it all you got. You should be sweating, working efficiently, working safely for your body. Bones of the big toes heavy, tailbone back, sternum reaching towards the back ribs. Brace those abs. 2 lunges, 8 scissor jumps or leg reaches. Transverse plane is where 90% of injuries occur, which is why we're moving in it. This is for injury prevention as well as heart health. Counting you down. 4, 3, 2, 1. Good job. Take that recovery. While we're recovering, I'll remind you of our final exercise. In the sagittal plane, we'll be traveling forward and back with either leg reaches or butt kicks. Choose what's best for your body. At the top and bottom, we'll place the ball between the knees and we'll sit back into a squat, swinging the arms into shoulder flexion and up. Exhale back, inhale up. And then we move back again, holding the ball at the chest for your butt kicks, runs, or your leg reaches back, and repeating those squats. Make sure you're breathing. Make sure you're aware of your feet. You're not pushing your rib cage out or the belly. The abs are bracing at all times. Counting you in. 3, 2, 1. 100% effort here. Give it all you got. That ball is going to go between the knees at the top and bottom. You're going to swing those arms into shoulder flexion, keeping your shoulders plugged down your back, your upper extensors of the back engaged. That serratus anterior, trapezius rhomboids, center of the upper back is working to hold the body in this upright posture in the squat. Shoulders are plugged down the back. Sternum is reaching towards the back ribs. Abs are pulling in and up. Halfway there. Remember those butt kicks to dorsiflex your feet. And every time the feet come in contact with the floor, you're really working through the bones of the big toes to combat the supination. That bow-leggedness and supination, all of which can be combated with awareness of your feet and ankles. Counting you down. 5, 4, 3, 2, 1. Take your recovery. Final recovery and final burst in the sagittal plane. Hydrate. Remember after this to start creating a log for a 21-day water challenge. If weight loss is a goal, fixing your water consumption can be a game changer. Another game changer is sleep. You should be getting 7 to 9 hours of sleep a night. If you are not getting that consecutively, that can affect your hunger hormones, and you're not going to be grabbing salmon and broccoli. You're going to be grabbing caffeine and sugar, and it's just a bad cycle that puts the body into. Your workouts won't be as efficient. So commit to 7 to 9 hours of consecutive sleep a night. Setting up, final set in the sagittal plane, counting you in 3, 2, 1, go. 8 butt kicks or leg reaches, ball between the knees, sitting back, moving into those squats, full range of motion. Make sure when you're doing your squats, you're not rolling back on the heels. You want to feel those bones of the big toes heavy, collarbone wide, upper back extensors engaged. It's harder to find the upper back when you're over recruiting the front of the shoulders and chest muscles. And since the upper abdominals are overactive with sway back posture, the upper fibers of the rectus abdominis and internal obliques, you really have to think about the sternum reaching towards the back ribs to close the rib cage and not over recruit to find the center of the back, the rhomboids, the trapezius, and that serratus anterior shoulder anchor. Counting you down. 8, 7, 6, 5, 4, 3, 2, 1. Great job. Take that minute recovery. Grabbing a sip of water, taking any stretch that feels necessary after that cardio burst work. So every time you work with us on your endurance, remember, cardio bursting is the most time-efficient way to condition the heart, but you should be pushing yourself to the limit. As hard as you can go with the awareness of your checkpoints. Your abs are always being braced. You're always thinking about what's happening in your feet, your knee traction, your rib cage, your neck alignment, retracting your chin so the back of the neck is long and the front neck muscles are working. We're going to move into some flexibility now. Setting up for a wall calf stretch, facing the wall, feet are hip distance apart, stepping one leg back for a calf stretch, opening up the gastrocnemius here, driving the heel down as the pelvis drives forward, tailbone reaching away, little lumbar extension. Without pushing the rib cage forward, close those front ribs, plug the shoulders down the back, retract your chin, back of the neck is long, eyes should be focused eye level. And think about your breath. Inhale, pull the abs in, lift up on the muscles that stop your stream of pee, hold that lift, driving the heel down and the pelvis forward at the same time. Again, inhale laterally into the rib cage, pull the belly button in, lift up on those muscles that stop your stream of pee, hold it, sustain it, drive the heel down and the pelvis forward. Keep going with that breathing. Back of neck is long, collarbone is wide. That front knee shouldn't be tracking beyond the metatarsals. Go ahead and step that back leg forward. Start with the legs hip distance apart, stepping the opposite leg back. Look over your shoulder. Is the leg perfectly parallel? That includes the foot. Drive the pelvis forward as you drive the back heel down. On your exhales, inhale through the nose, pull the abs in, brace the stomach as if you're going to be punched in the gut, drive the pelvis forward and the hips and the heel down, exhaling the air out the mouth. Be cognizant of your breath. Your eye focus is also important here so we don't encourage that forward head syndrome. So retract your chin, give me a double chin so the back of the neck is long. Watch out for the shoulders elevating, keep them plugged down. Sternum reaching towards the back ribs, closing, allowing access to the lower abdominals and the upper back. A few more seconds here. We'll move into a quad release on one side, kicking one heel towards your butt, grabbing the outer ankle, dorsiflexing the foot, soft bend in your supporting knee, bone of the big toe of your supporting leg heavy in the floor. Inhale, exhale to drive that thigh back, bracing the abdominals. Inhale, abs in, contract. Exhale, drive the thigh back. 2 more breaths. Inhale, contract. Exhale. And inhale, release the leg, turning and setting up on the other side. We're working on opening up the quadriceps after our cardio burst, all that hard work. Breathe in, make sure your supporting knee is bent softly. The bone of the big toe of the supporting leg is heavy, and you're really driving that thigh back on your exhale. We'll move to the floor for a prone floor twist, setting up a right angle, turning our head away from that right angle. That elbow of the right angle should be in line with the shoulder. Other hand by the chest, keep the head down as you spiral and lift the same leg as the hand by the chest up and back. The knee is bent, the big toe is on the ground. Dorsiflex the foot to keep the knee safe here. You're getting an opening in the pec minor as well as your hip flexors. Use your exhale as a chance to deepen the twist. Inhale, prepare. Exhale, twist deeper. Inhale, prepare. And here is a great chance to work on those ribs not spraying forward. Even though we're in extension, we want to find our back. We want to bring the sternum in towards the back ribs so that our upper back can fire here and we can pull our abs in to support the low back. Inhale, brace your abs and spiral out of the twist, making your way to the other side, setting up, creating a right angle, elbow tracks right in line with the shoulder, hand by the chest, head is turned towards the hand by the chest, same leg as hand by the chest lifts up, spiraling around, dorsiflex the foot, heel can rest on the ground, but watch that the knee doesn't start to collapse down. Keep lifting up from the top of the groin. The hip flexor will stretch here. Inhale, brace the abs. Sternum reaching towards the back ribs. Exhale, twist deeper. Keeping the head down, the temples should be resting on the floor. Retract your chin to keep the back of the neck long. And make sure you're breathing. Inhale, abs in. Lift in and up on the muscles that stop your stream of pee. Fog a mirror as you twist deeper into this nice prone floor pec and psoas opener. From here, we'll move into foam rolling for your IT band. You'll be in a side plank position. Don't collapse into that shoulder of the forearm that's down. Use it as a chance to also condition the lats. We'll walk forward and back, rolling out the fascia on the outside of the thigh laterally. Breathing. You can put that top foot down, either behind or in front, if that's helpful, or if keeping it lifted in the air and stacking the legs feels better, this is also an option. Just make sure you're not collapsing into the forearm, into the shoulder of the arm that's down. Other hand can be behind the head to support it, on the hip, on the roller, wherever it feels like it's out of the way and you can focus on the fascia release of your IT band. Go ahead and switch sides, setting up. And if at any time you have one side that's significantly tighter than the other, feel free to go back. Most of the stretches we're doing now, unless they're a release, are postural, so we're holding for a full minute. So you can stay for a minute 20 or a minute 40 on your dominant side and do a quick release on the non-dominant if it doesn't feel tight. Make sure as you're rolling here, you're not spraying the ribcage forward. We want to always be engaging our abs and our upper back as we work. This will bring us into that optimal alignment and perfect our posture, combat the kyphosis, and help alleviate chronic back pain. 15 more seconds here, finding fascia in the IT band, that overactive lateral chain, the hamstrings. even getting up into the glutes as you roll up top. From here, we're going to come into a rectus opener, rectus abdominis opener, getting into the upper fibers of the internal obliques and the rectus abdominis. Hands behind the head, place the roller behind your shoulder blades, feet on the ground, tailbone reaching towards the feet for some lumbar extension, and we'll allow gravity to do the work as we extend our chest, elbows pointing out to the side, chin retracted. Press your shoulder blades into the roller. This will intensify the opening and the upper fibers of the abdominals where you're overactive. Breathe here. Be cognizant of spraying the ribs forward. Go ahead and push those back ribs and shoulder blades into the roller, intensifying the stretch. Inhale, abs brace. Exhale, press the back ribs heavy, heavy, heavy. Chin retracted. Inhale, last breath, brace the abs. Exhale, press, 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 deepening and lifting up. We'll grab our ball to lie supine, placing it under our head for a figure 4 stretch, crossing our right ankle over our left and threading the hands through to bring the left hamstring towards the body. Opening that right thigh with the right elbow, dorsiflex the crossed leg foot so that you keep the knee tracking safely. Reach the tailbone towards the bottom of the mat in an effort to keep lumbar extension. And check in with your breath. Breathing in and exhaling. Deep inhale. Brace the abs, pulling that hamstring closer towards you as you open the opposite thigh, using the elbow as leverage. Go ahead and switch sides, setting up for your supine figure 4 stretch. You can also use this as a chance to stretch the back of the neck, giving me a double chin, retracting that chin, engaging your neck flexors to release the neck extensors. Make sure the foot that's crossed is dorsiflexed. The tailbone is down and reaching down towards the bottom of the mat, allowing you to access the upper fibers of the glutes as you pull. The glute med, the piriformis is opening. If you round your low back, you don't get the full attachment stretching. So make sure to try to keep the pelvis neutral and try and accentuate and reach the tailbone down and away from you for a subtle bit of lumbar extension. Just a bit longer here. 5, 4, 3, 2, 1. Our final stretch, we'll grab our heaviest Theraband. You can keep the ball under your head, hooking the band around the arch of the foot, sliding the other leg out long. We'll internally rotate the leg in the hip socket, taking it across the body for a deep IT band stretch. Reaching the tailbone towards the bottom of the mat, dorsiflex that foot, squeeze the front of the quadricep, lift the kneecap. You'll feel the peroneals, the outer calf, the outer hamstring, all the way up to the hip stretching. Do your best to take the rounding out of the lumbar. Imprint those back ribs into the floor at all times. Really activate them so we can turn off the pecs, the anterior delts, and recruit the upper back. Stay aware of your pelvic position, tailbone reaching away, collarbone wide, shoulders plugged down the back. Breathe in, pull the abs in towards the spine, lift up on the muscles that stop your stream of pee, hold that lift. Bring the leg a little farther across. Go ahead and switch sides, bracing your abs, setting up. Internal rotation of the leg from the top of the hip socket, crossing the body, dorsiflex the foot evenly from the outer and inner edge. Reach the back ribs into the floor, pressing them heavy, shoulder blades heavy into the floor. Chin can retract, lengthening the back of the neck, engaging your neck flexors. Tailbone reaches towards the bottom of the mat. Inhale. Brace your abs as if you're going to be punched in the gut. Deepen the stretch, dorsiflexing, squeezing the front of the quadricep and moving the legs subtly a little farther into the stretch. Inhale. Brace. Moving deeper into the stretch. Inhale. Abs in, contract them, hold the contraction, and exhale, deepening the stretch. Moving out of it with awareness, keeping the abs braced. Good job.